Venepuncture, essential blood sucking. Tommy, look lively, boy. Your patient requires a blood test. Think you could obtain a sample for us? Venepuncture, essential blood sucking. Begin by identifying the patient. That is, ensure you are sampling from the correct person. Many an error has occurred due to bleeding the incorrect patient. Isn't that right, Tommy? Introduce yourself and be confident in your approach. Nothing scares patients more than a quivering clinician advancing upon them with a sharp instrument. Once the patient has consented, you may continue with the procedure. Applying the tourniquet. Apply the tourniquet just above the elbow. That's it. Ensure it's fastened good and tight, Tommy. This will help you find a suitable vein from which to obtain your sample. Locating a vein. The most suitable veins are usually located in the antecubital fossa. It can be troublesome to visualize a vein for the novice. However, there are tricks that can aid the process. Asking the patient to make a fist, the use of gravity and gently tapping or stroking the vessel can all be of use when attempting to discern the position and course of a suitable vein. Preparing the needle. Exercise further caution once the needle shaft is exposed. We don't want to see any nasty prickings now, do we, Tommy? Removal of blood. With the patient suitably warned, be sure not to repalpate the cleansed area. Now proceed to insert the needle smoothly at the angle of approximately 30 degrees, levelling off when puncture of the vessel wall is felt. Advance the needle approximately 1 mm into the vein. Good show, Tommy. It is time to withdraw the blood using the vacutainer system. These are colour-coded, but trust me, operating them is simpler than salt. Needle removal. Smashing, sucking, Tommy. Now, after releasing the tourniquet, place sterile wool over the puncture site. However, do not apply pressure at this point. Should you do so, your patient will surely inform you of your error. Smoothly remove the needle and apply pressure until bleeding ceases. It is not unreasonable to ask the competent patient to apply said pressure themselves. Loose ends. So, you have the blood, Tommy, but there is still work to do. Don't forget to dispose of all the sharps in the appropriate receptacle. Ascertain whether the patient harbours any allergy to adhesive plasters. If not, you may apply one to the puncture site. Or one may use surgical tape to form a rudimentary dressing. Now complete the sample labels at the patient's bedside. Thoroughly wash your hands after the procedure has been completed. Tremendous job, Tommy. Now you know the basics of venepuncture, essential blood sucking,